Thank you everyone for coming to our medication education group today. Today we're going to be talking all about your kidneys. This presentation was prepared by our pharmacy director, Dr. Tammy Lee Demler, and it was approved by our medical specialist, Dr. Robinson, and is presented by myself, Dr. Joshua Seamock. I am the current pharmacy resident. So what we'll be talking about today is essentially why our kidneys are important, what can happen to them, what kind of problems might come about and how you would know that you had those problems, and other things coming from a pharmacy perspective. So what exactly do our kidneys do? Our kidneys do many things, but here are some of the most important ones. Removing natural waste products and extra water from your body, helping make red blood cells, balancing important minerals in our body, helping maintain your blood pressure, keeping your bones healthy. Alright, now let's discuss what can happen to our kidneys. So if we've ever heard of kidney disease, you've probably heard of CKD. That's what we call chronic kidney disease. And this tells us that the damage has lasted for at least 3 months. CKD also increases the risk of other health problems like heart disease and stroke. Developing chronic kidney disease is usually a very slow process with very few symptoms at the beginning, so it can be hard to diagnose, but at later stages of the disease, it is very obvious. We mentioned CKD as a risk factor to other diseases, but other diseases can be risk factors to CKD. Some of the most noticeable ones are diabetes, high blood pressure, also known as hypertension, heart disease and heart failure, obesity, and being of older age, typically over 60. We also know that having a familial history of chronic kidney disease or kidney failure can contribute to a risk factor, as well as personal history of acute kidney injury. This is a short-term kidney injury. Typically, these happen in relation to being in a hospital. Smoking and the use of other tobacco products have been found to make kidney issues worse. So why can this happen to kidneys? For many people, CKD is not caused by just one reason. Instead, many risk factors play in all together. And so we can look at these as being either physical, environmental, or social factors. Environmental factors can especially play a part. For instance, breathing in dirty air can hurt our lungs, and drinking contaminated water can cause stomach infections, and those both downstream affect our kidney health. Because, as we mentioned earlier, our kidneys are the ones that are cleaning up the waste products. Early detection is very important in CKD, and that often begins without noticing a symptom, but finding it on a lab result. And so knowing the risk factors can help us know when we should be looking for individuals that might have the kidney impairment. Other social factors also play into this. Things like how much money we have, our level of education, our relationships with our family and friends, that can all affect it. Discrimination and not having access to health care also has a huge impact. This diagram here relates to that. These are called social determinants of health. So even things like stress or the safety of your neighborhood can all come to affect your organ systems. And chronic kidney disease is one of those that really does show that many factors are playing into it. So then how would we know if we have chronic kidney disease if, like I said earlier, in the early stages there aren't many symptoms? Well, as the disease does progress, these are some symptoms you should be aware of that might make you think that there would be an issue. For example, foamy urine, urinating more often or a lot less often than usual, having itchiness over your body or dry skin, feeling generally tired, nausea, loss of appetite, weight loss without trying to lose weight. All these show that there's a systemic issue with balancing nutrients and waste products in our body. Like I mentioned, not until the advanced stages of the disease does this truly become an issue, or is that when we usually become aware of it. So here at Buffalo Psychiatric Center, your physicians and your pharmacists will be monitoring your kidney function regularly to confirm if your kidneys are working properly. So this is why it's important to accept labs. So, for example, a blood test or a urine test can help us calculate your kidney function. And all this relates to your weight, your sex, and whether or not you're on certain medications that can affect other laboratory values. So we do know that certain medication doses may need to be adjusted for people who have chronic kidney disease. We can tell this by finding this measurement called creatinine clearance. So this is how much creatinine your kidneys clear. And creatinine is one of those waste products that I mentioned before. Alright, so now we're going to get into our first video. I do have a small activity afterwards, so I'd like you to find at least one thing in this video that is worth sharing to the room.
Most people have two kidneys, about the size of their fist, located in their lower back. Just like your brain or heart, kidneys keep you alive. Many people know their cholesterol and blood pressure numbers, but they also need to know their kidney numbers to see if their kidneys are healthy or if they have chronic kidney disease, also called CKD. Having CKD means that you've had a kidney problem for at least 3 months. Chronic kidney disease can creep up on you slowly and silently. You can be losing kidney function for many years without symptoms. Many people find out that they have CKD only when their kidneys have failed and it's too late for preventive treatment. At this point, they usually need dialysis or a kidney transplant. That's why knowing your kidney numbers is so important. There are two kidney numbers: estimated glomerular filtration rate, eGFR, measured by a blood test, and urine albumin to creatinine ratio, UACR, measured by a urine test. The eGFR shows how well your kidneys clean your blood, and the UACR shows if there's a protein called albumin in your urine, which may mean that your kidneys are damaged. Along with your kidney numbers, your doctor reviews your health history and performs other tests. This complete evaluation helps to confirm or rule out if you have chronic kidney disease. The kidney numbers and different colors create the CKD heat map, which shows you the possible risk of your CKD getting worse and your risk for heart disease. The good news is that when it's found early and treated right, the outlook for kidney disease patients can be very bright.
Alright, hopefully you guys enjoyed that video. Kind of reiterated a lot of things I had already stated, but definitely the animations were very impressive there. So that's one thing I liked about the video. I did also like that the progression heat map. I think that's interesting when they showed the information like that. So I'll pause here for about 2 minutes and you guys can share in the classroom. Alright, I'll have the coordinator pause if we need more time for discussion, but let's continue otherwise. So, coming back to the issue of how am I going to know if I have chronic kidney disease? So, people that are a little more advanced stage, they might have more trouble concentrating. They could have numbness or swelling in their arms, legs, ankles, or feet. They might have achy muscles or cramping, shortness of breath, vomiting, trouble sleeping, and having a fishy scent to their breath. Some other important things to know and take away from this group today is that managing the chronic kidney disease and other conditions can really result to good outcomes. So that's the main reason why we think it's important to teach you about this, because then you can advocate for yourself. So taking steps to slow down the CKD disease process directly is the main thing that we want to do. But this also lowers our risk of cardiovascular diseases like heart attacks and strokes. Treating any complications of other diseases and of the kidney disease can help us make sure that we're not conflating the two diseases. So like on the last slide, we discussed tingling in the hands or feet might be a sign of kidney disease. But that's also a sign of diabetes. So if we make sure that the diabetes is treated and then the tingling happens in the hands or feet, then we could say that more than likely it's coming from a different condition. So specific treatment recommendations do depend on the staging of the chronic kidney disease and the other health conditions that are coming along with you. So here are some of the more specific recommendations. As per medication, your physician may prescribe one or more medicines that help slow down or stop the chronic kidney disease from getting worse. These medications typically include ACE inhibitors, like lisinopril, or ARBs, like losartan. Some newer medications might include SGLT2 inhibitors. Your physician may also prescribe a statin. These are cholesterol medicines. So guidelines recommend that a statin is on board for any patient with chronic kidney disease who also has diabetes or a history of heart disease or are 50 years or older, even if you don't have high cholesterol. A statin can help lower your risk of heart attack and stroke. So you see how multiple disease conditions might be playing into adverse effects from your kidneys going bad. You may also need to take additional medications or supplements to manage your chronic kidney disease complications that you might have when they're applicable. Another big part is having your nutrition be good. It is important to limit the salt intake, sodium, from your food to less than 2,300 milligrams per day. So that's about 1 teaspoon of salt from all the food and drinks that you consume in one day. This recommendation is very important because it can affect your blood pressure, sodium can. So if you have high intake of sodium, you're more likely to have a high blood pressure. Your physician may advise an even lower target for your salt intake depending on your health conditions. And some foods that don't really taste salty can have a surprising amount of sodium when you check their nutrition facts label. So that might be one place to actually remove more salt than usual and leave that to be used on foods that you think that they need them more. So based on the result of your blood tests, your physician may also advise you to change how much potassium, phosphorus, or calcium that you might be getting in your diet. So these are other minerals that our kidneys are regulating. So our kidneys are regulating sodium, potassium, phosphorus, calcium, and these all come from our food. So meeting with a dietitian can be especially helpful. And if you have any other health conditions, including diabetes or heart failure, it's very important to integrate a healthy diet and your lifestyle to help prevent further complications. It can feel very overwhelming to track all of these, but this is what we're here to help you with. All right, so the importance of that good nutrition for people with chronic kidney disease. We need to make sure that we're making healthy food choices. And this is especially important in chronic kidney disease because those choices can help slow down the progression of kidney disease, provide us more energy to do our daily tasks, it can prevent infections, and it can help us maintain our muscle mass and strength, as well as maintaining a healthy weight. That well-balanced diet gives us the right amount of protein, calories, vitamins, and minerals each day. So your dietitian has probably thought about this a lot. They know that eating a healthy diet and having you stay physically active, taking your medications regularly, being involved in therapy, all these are holistic things that can help with your health and feeling well. There's not only one correct eating plan for everyone, especially everyone with chronic kidney disease, but there are some certain things that we know that you can change to better yourself in general, like we were saying about reducing sodium salt intake. All right, as for lifestyle recommendations, we know that we could change a lot of things that would change our kidney function. Mainly, reducing smoking can help reduce the amount of toxic metabolites that our kidneys need to filter out from our blood. Also, exercising regularly teaches our body how to remain balanced. Another big thing that plays into that is sleeping well and making sure we feel well rested. If you're overweight, losing more weight because of a balanced diet or because of physical activity, this could also improve the health of your kidneys in many ways. So finding ways to reduce and managing our stress can also impact that. So ask your psychiatrist or your psychologist to help if that is your need. Additionally, there are some common medications that should be known to be avoided in people with chronic kidney disease. So some of these are our non-steroid anti-inflammatory drugs, which we usually call NSAIDs. Some of those are commonly ibuprofen, which is called Motrin or Advil. We also have naproxen, which is Aleve, and aspirin. So all that being said, what should you take away from today to really impact the health of your kidneys? So what you can take away from this are a few questions that you could bring up to your physician or your pharmacist or your psychiatrist. What are my renal function numbers? We should have those documented, and it's probably easy to get them back to you. What is my level of risk for developing heart disease or stroke, and what can I do to lower my risk? This is something that your physician has spent a lot of time making sure that your risk is low. Am I at a healthy weight? This is a question that is answered differently for everyone, but your physician should be able to help with that as well. Is my blood pressure within the recommended goal? Is my A1C, which is a measure of your blood sugar over 3 months, is that in goal? Are there certain changes I should make to my diet or exercise routine? These might be some questions that would be good for your dietitian or your psychiatrist. Are there any changes that I should make to my medications that would lower my risk? Your pharmacist probably knows this pretty well, and typically the medications that you guys are on here are fairly safe. So let's get into some questions here. Which of the following is a job of the kidneys? I'll read through the answers and then I'll ask for everyone to raise their hand for the one that they think is right. Okay, so A, they make white blood cells. B, they remove waste and extra water from the body. C, filters pollution from the air you breathe. Or D, produces acid for food digestion. So hands for A, white blood cells. Hands for B, removing waste. Hands for C, filtering pollution from the air. Or D, produces acid for food digestion. So the one that I selected here is B. We know that the kidneys are removing waste and extra water from the body. Your kidneys do many important things. Some of the ways that they keep your whole body in balance include mainly removing natural waste products and extra water from your body. They also do help make red blood cells. They help in balancing the minerals in your body, helping maintain your blood pressure, and keeping your bones healthy. Next question here. So what is a risk factor that increases the chance of having kidney problems? I know that we talked a lot about them, and it may be hard to remember all of them, but let's see if we can notice which ones we didn't talk about. So A, being younger than 50, hands up for that one. B, being underweight. C, having high blood pressure. D, not eating enough salt in your diet. So the one that sticks out to me most is having high blood pressure. So we know that having high blood pressure is a common issue between a few disease states. Diabetes, heart disease, heart failure, obesity, and older populations, especially those over the age of 60. Our next question here is about managing chronic kidney disease. Which of the following is a goal that we discussed? A, managing your blood pressure. B, taking steps to slow down the chronic kidney disease process. C, lowering your risk of cardiovascular disease, or all of those? All right, thank you guys that left your hands up for all of those because that is correct. These are the main goals. Managing the disease or the condition that is most likely causing the chronic kidney disease. For example, uncontrolled diabetes, uncontrolled high blood pressure. Taking steps to slow down the chronic kidney disease process directly, lowering your risk of cardiovascular disease, like having heart attacks or strokes, and treating any complications that you may have because of the chronic kidney disease. So that gets us back to thanking you for coming today. So we will have another activity right after this, and you will be able to ask any questions you like to our pharmacy staff. Thank you again.